Hello, Partner for Vaccine Equity learning community members and others working on vaccine equity, and welcome to today's learning event, Best Practices for Program Evaluation. I'm Leandra Lacey, and I serve as a Training and Technical Assistant Specialist with the Urban Institute. On behalf of our team at Urban, thank you so much for joining us today. Today, we will hear about promising strategies in creating an evaluation plan, as well as hear from PAVE member organizations about their experiences using evaluation to inform their programming. This learning topic came requested from learning community members, so we hope that you find the content useful to your work. Before we go further, I'm going to do a very brief review of how the event works. You've all been muted upon entry to this session. If you can request to be unmuted if you'd like to speak a question during the Q&A session at the end, and you should use the raise hand feature to do that. You can also type a question for the speakers into the Q&A tab at any point during the session, and we'll get to as many of these as we can at the end of the presentations. The chat room feature is also open today, but if you have a question for the speakers, please put it in the Q&A so we are sure to see it. We might miss it if you put it in the chat. We offer live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, we will post the slides and a recording of this event available to the learning community members and to attendees. Our inbox, vaxequitylearning@urban.org, can always be used to contact us if you have technical difficulties during the session. And now it's my pleasure to introduce our fantastic lineup of speakers. Since we have so much great content to cover today, I am going to keep those intros pretty brief since my colleague will post a link to a document with longer biographies that really do these speakers justice. So please check that out. That document will also be shared with the slides and the recording from today. Our first set of speakers discussing best practices for creating evaluation plans is Gisela Medina Martinez and Amima Asif from the CDC. To talk about how they've used evaluation, we will then hear from PAVE members. First up will be Tamara Labros and Amanda Lahir from Live Healthy Miami Gardens, a program with the City of Miami Gardens. Then we will hear from Laura King and Dr. Dara O'Neill at the American Heart Association. Lastly, we will hear from Dr. Cherie Holmes-Kitt and Kalandra Tibbs from Community Catalyst. Thanks to all of our speakers for being with us today. I'll pass it over to Gisela and Amima now.
Hi, everyone. Thanks so much for joining. My name is Amima Asif. I'm an ORICE Fellow in the Immunization Services Division at CDC. I'm currently supporting the work of the RME team for adult immunization programs. Today, I will be providing an overview of program evaluation in public health to you. Next slide, please. We will be discussing two main elements of evaluation today. As a first step, we will try to get clarity on what program evaluation means and how to distinguish it from research. In the second part of the presentation, we will review CDC's evaluation framework and its different components. In the end, we will also provide some resources and tools that you can take guidance from in your future evaluation work. Next slide, please. The CDC's introduction to a program evaluation for public health programs defines program evaluation as the systematic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, improve program effectiveness, and/or inform decisions about future program development. I will expand a little bit on this definition for the sake of simplicity. What this definition is summarizing is that evaluation is intended to assess the efficiency and effectiveness of programs, policies, and organizations through systematic data collection and analysis. Next slide. So why do we want to evaluate or conduct evaluations? As one of the 10 essential public health services, the purpose of public health assessment and evaluation is to demonstrate the success or progress of programs, policies, and initiatives. Furthermore, evaluation is also intended to examine program strengths and weaknesses, identify promising practices, and improve program design, implementation, and impact. Next slide. Another important question to answer and get more visibility on before moving forward is, what is research and how do research and program evaluation differ? Research and evaluation are both systematic processes that are utilized to understand the dynamics of programs, policies, and health systems. However, there are a few differences between evaluation and research. Research is designed with an intent to pursue answers to questions that create new knowledge, whereas evaluation focuses on program improvement by using data to guide decision making, determine if and how a program is meeting its goals and objectives, and to establish long-term effects of a program. Next slide. Moving on to the CDC's evaluation framework. It is an established fact that health improvement is what public health professionals strive to achieve. To reach this goal, we must evaluate the effects of public health actions. CDC developed this evaluation framework to ensure that amidst the complex transition in public health, we will remain accountable and committed to achieving measurable health outcomes. In the next slides, we will dig deep into the different components of this evaluation framework. So for robust public health programs with a solid evaluation plan and structure, it is important to ensure that programs and evaluations are both integrated. For the sake of clarity and simplicity, this important element is presented as a continuous quality improvement cycle that includes planning, performance measurement, and evaluation. Our goal is to see evaluation as something that feeds planning and is fed by planning and performance measurement. Another point here to highlight is that CDC's evaluation framework has a utility-based approach. What that means is that we are aiming to improve a program, policy, or procedure through this entire exercise. Next slide. The first step in the framework is engaging stakeholders. What this means is that deciding who needs to be part of the design and implementation of the evaluation for it to make a difference. The broad categories of important stakeholders are the ones that add or enhance the credibility to the evaluation or the program, advocate on behalf of the program, implement findings, and fund or authorize the program. Next slide. The second step is describing the program. We want you to make sure that there is clarity and consensus on what the activities of the program are and what the intended outcomes are. Often we use a logic model for this. The logic model is a tool for program description. It graphically describes the program and the relationship between the activities and intended outcomes or effects. Next slide. Here is a template for a logic model. It can be as simple as this table. As I mentioned earlier, a logic model depicts what a program plans to achieve over time. It makes explicit the connections between a program's inputs, activities, outputs, and outcomes, and the assumptions that these are based on. It is important to note here that a logic model is not static and it can be updated as things evolve in the program. Next slide. The third step of the framework is where it all comes together. We call this a utility focused evaluation. And so this evaluation step is really the big leveraging part of our approach. Here, you're going to decide which evaluation questions are the key ones. You need to apply some decision rules to select the most important questions for evaluation. Next slide. Taking the evaluation design one step further, we will establish clear evaluation questions. Clear evaluation questions encourage stakeholders to narrow the evaluation focus by stating what aspects of the program will be further explored through this evaluation. The questions will help identify whether the evaluation focus will be on program processes or outcomes. There are some key differences in evaluation questions for a process evaluation versus an outcome evaluation. On the next slide, we'll explore these main differences. The type of evaluation. Sorry, I'll speak a bit slowly. Yeah. So the type of evaluation that will be conducted depends on the stage of the program. A process evaluation is generally conducted on new programs, whereas an outcome evaluation is conducted on more established programs. A process evaluation focuses on the program or a component of the program, with the goal of establishing whether you have hit quantifiable targets and implemented strategies as planned. It documents what the program is doing and to what extent and how consistently the program is being Next slide, please. I think the next slide didn't change. Sorry. So basically what I was saying was that a process evaluation focuses on the program or a component of the program with the goal of establishing whether you have hit quantifiable targets and implemented strategies as planned. It documents what the program is doing and to what extent and how consistently the program is being implemented. On the other hand, an outcome evaluation measures the change in knowledge, attitudes, and behaviors that has occurred as a result of the program. Lastly, the evaluation questions that you identify will help determine the most suitable evaluation design and ultimately the best data collection method for your program evaluation. Next slide, please. An important thing to note about these three first steps of the evaluation framework is that they're iterative. Insights on any one of the three steps can cause you to circle back. You can start on step one with engaging stakeholders, get to step two and describe your programs. Then suddenly when you're setting your evaluation focus, you may identify an outcome that you hadn't realized before or a stakeholder who turns out to be important. So the process is iterative. Having said that, it may be helpful to start with step two, the program description and the logic model, then frame the stakeholder engagement and then the evaluation focus. So, but any of these steps in any order will work. However, what is important here is to dig deep into all three steps before proceeding to data collection. With that, I'll hand it over to Gisela.
I was on mute. Thank you, Mima. Next slide, please. We are in step 4. These steps is really like any data collection procedure have ever been part of. Step 4 is called gathering credible evidence, and this is the point at which you will write your indicators and you will make your choices about data collection sources and methods. Please remember, you develop a logic model in step 2, as Amima described it, where you already have an idea of the indicators you will have for your program. You will need to refer to the output section on your logic model. Next slide, please. In step 5, you are going to put all together and you are going to draw conclusions. You are going to review and interpret your evidence. You are going to analyze, review, and interpret your evidence and use it to determine whether the program has been a success or not. Next slide, please. Finally, it all culminates in use of lessons learned. If we have done a good job, the whole purpose of this is to use the evaluation results in a meaningful way. We can ask questions like, did we reach or met our goals? Do we need to change the strategy? Are we targeting the intended population? Just as an example. Next slide. So here we have the evaluation standards. The standards are at the center of the evaluation framework. And while some people see those as a way to do evaluation, they play a much different and in some ways more important role. The standards help us make informed and good choices at every individual step of the framework. Rather than telling us how to conduct evaluation, what the standards do is help us sort through the options and tools we have in any of the 6 steps. The first group of standards relates to utility. So utility it is useful to identify who needs the information from this evaluation and what information do they need. For example, you may have identified several stakeholders, maybe 30, 20 stakeholders. If you apply the utility standard, you can easily narrow down 30 stakeholders to the 5 or 6 that matter most for this evaluation this time. You can narrow down 100 ways of collecting data to the 6 or 7 that are really going to matter for the evaluation and the intended users of these findings. The second group of standards refers to feasibility. This standard help you identify how much time, money, and effort can you really put into this evaluation this time. The third one is Propriety Ethics. This evaluation standard help you by asking if there is some approach we need to take or someone we need to engage in the evaluation for be ethical. And evidence gathering, we are always going to ask ourselves, are there ethical questions that will lead us to one data collection method as opposed to another? At the stakeholder step, we are always going to ask, is there a stakeholder out there I absolutely need to engage to truly understand this program? If I am doing a community intervention, for example, it will be unethical to not engage as one of my stakeholders the people participating in the intervention. And finally, we have accuracy. We will ask ourselves, what design will lead to accurate information? Next slide, please. In summary, the 6 steps from the CDC evaluation framework and the 4 standards help ensure use of evaluation findings, and that is the whole goal of this, to get some use of findings for program improvement or conceptual understanding of how a program should work. The steps are systematic, dynamic, and iterative. The early steps are set as a frame or reference to help you make better choices in the later steps, and then the standards are at the center of the framework, and they help us in the planning of each step. They either broaden our view and they remind us the evaluation is situation specific, and good choices this time may not be the same choices next time. So how can we translate this into our evaluation plan? Perhaps these steps mentioned above may seem simple to you. We have organizations or partners that have the capacity building and experience to carry out any type of evaluation. But we also have partners who need more program evaluation support. So your evaluation plan should have at least these 6 steps from the CDC evaluation framework. This is a guide, so we always suggest you adapt this framework to your program. This framework should help you describe your program by using your logic model. This should help you identify your performance measures, or as you describe it, your outputs in your logic model, and help you develop data collection methods and reporting methods. If you want to discuss any of these steps in detail, please notify your CDC project officer or CDC technical monitor so we can find alternatives on how to best assist you. Next slide. This is a list of accessible resources to help you understand the CDC evaluation framework and the evaluation plan. We can share these with you after the webinar. Back to you, Leandra.
Thank you so much, Gisela and Amima. I'll remind everyone that you can submit questions for our presenters in the Q&A feature, and we'll address them all at the end, or try to address them all at the end. Next, we'll transition to Tamara Labros and Amanda Lahir with Live Healthy Miami Gardens.
Good afternoon, everyone, and thank you so much for having us. We're honored to be on with you to share a little bit about our experiences in South Florida, sunny, beautiful South Florida. Live Healthy Miami Gardens was started in 2014. Next slide, please, sorry. Live Healthy Miami Gardens was started in 2014 to help drive citywide changes that measurably improve the health of people who live, work, and play in Miami Gardens. Live Healthy Miami Gardens is the city's strategic and systemic effort to reduce poor health outcomes by engaging community residents. As background, with a population of over 113,000 residents, Miami Gardens is the largest majority Black city in Florida, and we are the 3rd largest city in Miami-Dade County. Our population is 72% Black, African American, and 27% Hispanic. And largely due to that makeup, to that demographic makeup and economic profile, Miami Gardens also is one of the Florida's largest concentrations of health risks and chronic disease in the state. So we started Live Healthy Miami Gardens really to ultimately look at the health disparities in Miami Gardens and to try to move the needle on these health disparities. We focus on 5 health impact areas, which include alcohol, tobacco, and other drugs, eating, healthy eating and improved nutrition, physical activity, mental health, and primary health care. Live Healthy Miami Gardens right now is made up of about 100 individuals in 67 organizations. Next slide, please. Currently, we are funded by the CDC, the Florida Department of Health, the National League of Cities, and the Health Foundation of South Florida, which was our original funder. Next slide, please. I've already covered the health impact areas. Next slide. Live Healthy Miami Gardens uses the collective impact model. I think many of you are familiar with that. The City of Miami Gardens, who I work for, serve as a backbone organization, and the other components within the collective impact model includes mutually reinforcing activities, continuous communication, shared measurements, and common agenda. Next slide, please. Next. Here are our values. Our values were established through a community planning process with over 100 stakeholders, and they are accountability, community engagement, education, health equity, sustainability, and we're also data driven. I just would like to mention a couple of things in regards to our values. Our values have really helped to lay the foundation to inform our evaluation work, and our evaluation processes have been in place from the very beginning of Live Healthy Miami Gardens. We started mostly as a working with a process evaluator just to really evaluate our ability to engage our community, to ensure that residents had a voice in the formation of Live Healthy Miami Gardens. And since then, we've moved into really being much more data driven and looking at outcomes and indicators as part of evaluation. Next slide, please. And now I'm going to pass it on to Amanda, who's going to cover some of our core evaluation elements. Amanda?
Thank you, Tamara. So because we are a collective impact initiative, we're going to be talking about all of our evaluation strategies as a whole. So next slide. So the first piece of how we keep evaluation at our core is to remember to always communicate impacts. Next slide, please. So through communicating impact, we have to think about the modes that we're able to do so. And so in Live Healthy Miami Gardens, we've taken time to do both a theory of change for the overall initiative, as well as logic models for each health impact area to really understand where we're starting and where we want to go long term. We also are in the process of creating a data dashboard where we're going to be able to communicate both our processes and our long-term impact from an evaluation perspective. And then we've also made sure to do cumulative reporting so that we're reporting not only internally, but we're talking about the impact that we've made long-term to community members as well. Next slide. We also always need to think about how we're communicating this impact. And through COVID, we've really learned the importance of having multiple ways that we're giving out this information to really ensure that we're being equitable in doing so. So thinking about communicating not only in print materials, but we've done so through our website and social media, and also taken to television and radio. Next slide. And finally, it's always important to think about who you're communicating that impact to. And so because we are a community-led initiative, making sure that the community members are not only aware, but in that process of impact and learning about some of the work that we're doing, as well as being at the table while it's happening. Ensuring that those in network are aware of the impact that they're creating, as well as outside entities really communicating that to other individuals, as many of us are doing here today. Next slide. The O is to operationalize all aspects of the work intentionally and holistically. Next slide. So we always think about the question, how can I tell our story, right? What is the way that we can tell our story and how can we be intentional about doing so? And so the first piece is to really think about capturing both process and impact. What are the activities that you're doing, but also what is that change that you're trying to create? We're doing so through our Live Healthy Miami Gardens initiative level measures, where we're capturing not only the strategy outcomes that we're looking at, but also the initiative as a whole. We also always ask that question and think about how we can be intentional about what we're measuring. And so a great way to do that is through the logic model, as you just all heard, really thinking about not only what you're doing, but how it all connects together, and to really make sure that you're operationalizing everything in a way that makes sense for your story, as well as to really capture that true impact that you're trying to make. It's also important to consider timing. So not only when you're capturing these measurements, but thinking about the environmental and time context, right? COVID really taught us that there's a big influence in our evaluation, in our data, in our numbers. And so it's important to also think about the environmental and time period when you're capturing some of this information. And then to ensure that you're doing this from a holistic perspective, it's important to make sure that you're really using mixed method approaches. And so because we're a community-led initiative, making sure that we're hearing from community members in focus groups, as well as in surveys, and having that quantitative data from our grantees, as well as focus groups talking to them about their experience, really helps to inform that evaluation process. Next slide. And then the R is to remember to consider all perspectives. Next slide. So from this perspective, we're thinking about hiring an internal evaluator or an external evaluator, and what are the pros and cons to both. So from an internal perspective, you really get that boots on the ground feel. You get that insight of people that are within the community. And because of this, they're often invested in the success of the work and the community as well. Having an internal evaluator also allows for organizational learning and building that capacity internally. But having an external perspective is also really important because it is an objective perspective from a different lens. So oftentimes you can have somebody come in that can look at a challenge differently and maybe provide a solution that wasn't thought of previously. It also ensures that evaluation is at the focus. So a lot of times, if somebody's an internal evaluator, they may be juggling multiple roles. So this is really ensuring that time is dedicated to that evaluation piece. And as a result, you can make timely modifications in doing so if any challenges or changes need to be made. In addition, it also promotes capacity building. So having an external evaluator usually ensures that you have that expertise at the table. But what we wanted to kind of mention in this next slide is that you should consider both. So next slide, please. So at Live Healthy Miami Gardens, we have both external evaluators, which is my role, and then we have that internal perspective where we're working together to have that mutually beneficial relationship to learn more about the community and also to provide that expertise so that we can really evaluate the program as a whole. Next slide. And then the final is our E, embrace and integrate evaluation in all aspects of the work. Next slide. So we thought that this quote really enveloped this point that we're trying to convey. So it says the natural response to evaluation is to feel judged. We have to mature to a place where we respond to it with gratitude and love feedback. So basically what this is saying is that oftentimes we're afraid of evaluation. We come in and we think it's meant to be punitive. But in reality, evaluation is really there to help enhance your work, ensure that you're going in the right direction and that you're really making the impact that you hope to do. So looking beyond just that intention and really looking at the change that you're making. But in saying that, it's important to note that evaluation is a two-way street. So not only having the organization open, but having the evaluator open to hearing feedback from the organization and really open to communicating that information in an effective and in an important way. And so in Live Healthy, what we do is we have a data and evaluation committee where we really come together and have these conversations as a whole, get that community insight and make sure that the right people are at the table so that evaluation is really a holistic and inclusive process. Next slide. Thank you so much.
Awesome. Thank you so much to our colleagues at Live Healthy Miami Gardens. I'll now pass it on to Laura King and Dr. Daryl O'Neill with American Heart Association.
Thank you. Okay, so I'm Laura King. I'm the Director of Public Health and I'm the Principal Investigator for both the REACH grant that we've received from the CDC as well as the COVID flu vaccination supplement. And so the focus of this presentation is actually on our COVID-19 flu vaccination effort. And I'm partnering up with our Senior Evaluist and Program Improvement Specialist, Daryl O'Neill, who will also be tag teaming on today's presentation. Next slide. So our project actually isn't happening in El Paso County in Texas, and it's a really interesting geographic location. For those of you who are not familiar with it, it actually is a border county, which added some really unique elements to consider as we were embarking not only on our REACH grant, but specifically when the COVID flu supplement came into effect. And we were recipients of both the initial flu supplement that was put out there, and then basically around 6 months later, the COVID flu funding was announced, and we pursued that. So the presentation that we're actually conducting today actually incorporates both some of the activities that we did for both supplements, because it was fast and furious as we transitioned across both, as well as there was lots of overlap between the two funding streams. So a little bit about El Paso. I mentioned it's a border county, and as part of that, there's actually 6 unique border crossings. Some are for vehicle traffic as well as pedestrian traffic as well. The county itself, what's also fascinating about it is that the Hispanic Latino population is actually almost 83% of the population as a whole. And so the minority is the majority in this community. And so that certainly means that we were very mindful all along around, being of the community, making sure our materials and products and the strategies we were doing were really reflective of the Hispanic and Latino population. While English, is predominantly spoken at home at almost 70%, everything we were producing was being translated and made available in Spanish as well. And so, we're really proud of the vaccination rates that we've achieved to date. Just at this point, almost 100% of the population has been partially vaccinated, and just a little bit over 80% when we created this deck was fully vaccinated. Next slide. I'll pass it on to Dar, who will take a little bit of a summary of our evaluation approach.
Thanks, Laura. So our evaluation approach mirrors somewhat of some of the earlier slides in that we have 3 purposes. We're looking at how well we've met our objectives, how well the program is being implemented, and most importantly is we're using the evaluation data to continually inform our implementation, decision-making, all the kinds of things that happen on a day-to-day basis, because this is such a fast-moving project. As we know, the COVID world is rapidly changing, and so we've had to make adjustments on the fly. So evaluation has been key to that. We're using mixed methods in our approach. We're doing use both quantitative and qualitative data from multiple sources. And as I mentioned, we are primarily focused on continuous program improvement. So our evaluation has been flexible in changing as needed. Next slide, please.
So with that, one of the things that was really important for us right off the bat was to make sure that we were really quickly identifying the community needs, even prior to the pulling together a funding application. So for those of you who ended up pursuing these funding streams, you will remember the flu supplement opportunity. We had essentially 7 business days to pull together a plan, so not a lot of time. And then when the COVID flu supplement came about, we had essentially 3 weeks to pull that plan together. So it was really important for us to be working with partners to build on the existing strategies and approaches that they were undertaking, and to cultivate those relationships very quickly. We really wanted to make sure that we were sort of plugging in opportunities for perhaps gaps that they had identified or were limited by their own funding portfolios, but they saw the needs that needed to be filled, and could these resources be allocated in that way. we had the opportunity, of course, using the data from the CDC and the maps that were being produced to share with partners, and that helped to ensure buy-in for the rationale for some of the activities that we were proposing and the rationale behind those. We embarked on community conversations, the utilization of the data and those maps, as I mentioned, to really refine and actually build targeted approaches to reach the priority populations that we were desiring to reach, specifically in key geographic areas which had low vaccination rates. And so we were using, of course, that analysis through census tracts and zip codes to really hone in on where we needed to go and where additional sort of bolus of focus needed to be as well. We ended up conducting regular reviews as part of our ongoing assessment of the needs in collaboration with our partners on the ground. And we wanted to ensure that we were really shifting the approaches based on what was happening across the pandemic, the various surges, and also vaccination rates. And as all of you will, remember, I mean, this sometimes was like, those shifts sometimes felt like they were daily. And, you were starting to build a strategy, and 2 days later, something new was coming down the pike in terms of information or data or trends and on messaging. And, we would just make a decision, okay, that plan, does it still fit the bill and what we're trying to achieve? And if not, then we would just pivot. And so that was really part of the ongoing sort of program performance and improvement process that we had adapted to. And along that way, we wanted to really think about sort of the integration of evaluation into that program planning. And so that was some of the approaches that we also undertook. Next slide.
So the next few slides are going to talk some very applied aspects of data collection and some of the techniques that we've used to help us inform our activities. We found that since we're working with so many partners, just asking for data is not necessarily the best approach. Helping to explain why it's needed and how we're using it and how it can also benefit them seems to be something that works well for everybody. We had maps that showed different priority areas in El Paso, in the El Paso County area, based on different criteria, and we were able to show that to our partners, which helped them identify where vaccination clinics were needed most. So sharing our need for the data, as well as sharing the data that we had with our partners, really helped get everyone on board. We worked with our vaccination partners to disaggregate their data. They not necessarily put it in the categories that we needed. So we worked with them to show what we needed and how we could work together to put it in that format. Also, one thing that we've been asked to do is to provide the number of people from racial and ethnic populations of focus that we're reaching, and many times this has to be an estimate. And so we're using census estimates of the number of, for example, the number of attendees at an event times the 82.9% Hispanic population in El Paso County to give us the number. So that's just kind of a real world tip on how we do some estimates for that. Similarly, if there's a Spanish post that goes out on Facebook, we're assuming that's also reaching the Hispanic population. So there's some estimates there. Next slide, please. As this was changing so quickly and we needed to report every month to CDC, we decided to hold monthly meetings focused only on data collection and reporting. That helped us keep track of where we were and not forget anything. Since it was so fast moving, it was very easy to not keep track of things or lose them. So we kept a Word document that kept everything together, so we knew what we had done in the previous months and what we had reported to CDC, so we were making sure we weren't missing anything, as well as making sure we were capturing everything. We put this on a shared drive so that everyone on the team can see it at all points in time and add notes as needed. It just helped us really keep a record of what we were doing and how to account each activity. Next slide, please. And then finally, we conducted an internal focus group team, an internal team focus group to discuss what our lessons learned were from our project activities for this and other efforts. And that is really to try and capture kind of the institutional knowledge of what works, what doesn't work, so that we can apply it to this project as well as to future projects that may come down the road that are innovative, such as this one. And so I think that was really helpful to us to kind of identify what the main activities were that have been very successful and those that have been challenging and how we might change those in the future. We also developed an internal dashboard. I saw other folks were talking about a dashboard earlier. This we just did in Excel as a quick way to get this up and running. And this helped us keep track of what our goals were and where we were. And so you can easily color code in Excel cells. You can see your red, yellow, and green over there. The green meant we've reached it. Yellow meant we were on target. And then red meant we needed to do some work in that area. So I think that's a very helpful way of keeping track of where you are and what you need to do in a very cost-effective and easy way to go. Next slide, please. And I'll pass it back to Laura.
Sure, thank you. So what did this actually translate into in terms of successes and efforts for programmatic decision making? So one of the things that we undertook was we really looked with our partners at the existing vaccine locations and identified areas where there may have been lack of coordination amongst the three primary vaccination providers, or if there was overlap, in terms of capacity and effort. And so what that meant was that we, worked very collaboratively with those providers and worked with them to agree on sort of assessment criteria to identify where they would indeed sort of put their own efforts into ensuring that we had as much of a swath of the whole county covered from a geographic perspective. And that really contributed to the overall capacity and reach. There's some efficiencies being, maximized there, as well as identifying sort of different population groups that each of the three vaccination providers ended up, sort of being their primary target audience. We mentioned we shared the Deloitte maps with them to think about sort of through sort of where there were gaps in coverage, and that sort of ended up being sort of netted out in sort of two strategies. One, thinking about sort of the implementation of the mobile clinics that we built, and that was really to try to ensure that the vaccination clinics were being, made available in underserved areas, as well as those who had high need. And then, also additionally, that there was some targeted social and digital media in those particular zip codes to ensure that the community actually knew that these clinics and these vaccination services were made available locally, and that was really primarily to address a couple of things. One, that we knew that transportation and cost wasn't a significant factor for consideration if we were going to be able to draw in individuals to actually get vaccinated, in addition to addressing what many of us were dealing with, which was, hesitancy, myths, and just overall confusion around the messaging at the time. And so, between June and March, we had over 204 new vaccination sites that were established, and well over 1.5 million impressions and clicks through our social media efforts. And then, another sort of exciting endeavor was really around sort of the, when we had identified that there were low vaccination uptake, particularly amongst the 25 to 40-year-old age group, we knew that age group would likely be parents. And so one of our vaccine providers was already holding vaccine clinics in schools. And so this is just one small example around how we tried to broaden what had been a longstanding school vaccination clinics where schools were used to being able to provide these, but that was really obviously targeted to children, which was outside the scope of the supplement and of what was allowable population for us to use these resources. But schools are hubs of the community. They're a hub to parents and community members, and so great setting for expanding those clinics and making the adults vaccination also available beyond just targeting children. And so between June and March, we had over 18,000 adults vaccinated through our school effort, and over 300 schools participated. So just another example of sort of taking something that was already working in one way and expanding the scope, and really, again, addressing some of those geographic challenges. Next slide. Great. So, as we move forward, of course, we're really thinking about sort of the next 6 months, and we have applied for an additional year worth of funding through this the ongoing funding opportunity that the CDC announced most recently. So as we think through sort of what are some of the the upcoming evaluation questions, you know, one of the questions that we are thinking about is how do we continue to address the vaccine hesitancy issue, particularly around boosters. And so, you know, we are thinking about sort of as an example, like why did seniors, you know, the 65-year-old plus originally have very high rates in vaccine uptake, but are not receiving booster shots. And that's something that we're seeing as a trend right now in El Paso County. And then, you know, another question we're seeking to answer is, you know, how do we ensure we are adequately meeting the needs of the Black population, which is actually 4% of the population in El Paso County. And so we continue to try to figure out different approaches, strategies, so that we are ensuring that we're meeting the needs of that population. And so, and really building a complete separate work plan based on sort of that goal. And then the last thing we're looking at doing is thinking about the availability and the criteria. So, you know, of course, with the shift around, you know, the coverage, you know, around the vaccine, sort of how do we ensure that, you know, age and insurance is factored in here. In particular, there's an interest within the AHA around those 65 plus that they actually receive the high dose flu vaccine, and what can we be doing to make sure that the availability of high dose flu vaccine is you know, accessible to that population group. So those are some of the upcoming evaluation questions that we're building into our plans, not only in the next 6 months, but also into what would be considered the next supplement phase of the COVID flu supplement. So with that, I think that's our last slide. You know, happy to answer any questions at the end of the webinar, and I will, and if you could just move the slide ahead, you know, here's our contact information. If you have any questions, you're welcome to email them to us directly. Thank you.
Awesome. Thank you, Laura and Dr. O'Neill. Last but not least, we'll transition to Dr. Cherie Holmes-Kidd and Calandra Tibbs with Community Catalysts.
Next slide, please. Thank you. Good afternoon. I'm Cherie Kidd. I'm the program director at Community Catalyst, and I'm here to co-present with Calandra Tibbs, the CEO and principal evaluator at Trifecta Advising. So Community Catalyst as an organization, we have a mission to build the power of people to create a health system rooted in race, equity, and health justice in a society where health is a right for all. Overall, we work with state and locally based groups in more than 40 states, excuse me, to build consumer leadership and center the needs of communities by providing funding, resources, technical assistance, and coaching tailored to the unique circumstances of each organization and their environment. Next slide, please. Via the CDC's Partnering for Vaccine Equity funding, our project, the Vaccine Equity and Access Program, VEAP, was established. We just ended year one, and in year one, we provided $9 million of funding to 90 community-based partners in 40 states in the District of Columbia. These partners are working in communities that are experiencing racial and ethnic disparities in COVID-19 and influenza vaccine uptake. Their three main priorities are to identify and engage community leaders who reach people where they are and serve as trusted sources of information for COVID-19 and flu vaccines. The second priority is to increase vaccination opportunities and enhance provider partnerships. And lastly, engage in partnerships with state and local health departments. We also funded 3 national partners, Leading Age, the Protecting Immigrant Families Coalition, and Young Invincibles to conduct vaccine confidence building and vaccine access strategies focused on important segments within our target populations to include older adults, young adults, and the immigrant community. In terms of our evaluation, to have a successful program, we engaged a consultant, Trifecta Advising, to design and conduct a process outcome as well as outcome evaluation activities. The goals were to gather data around the effectiveness of our work in this first year of the project, as well as the work of our CBOs in meeting our overall program outcomes. So now I'm going to pass it over to Calandra Tibbs.
Thank you, Cherie, for having me here. I want to share a little bit about our evaluation process, how we developed the plan. And I think it's important to note, because Community Catalyst is a national partner funding these 90 organizations, our evaluation approach had to be broad enough so that we could capture both specific information, but information broad enough that we could apply it to the program implementation of a variety of programs and projects. So by engaging with our organization, we were able to come in as partners and look at opportunities to fully see what was going on, not only for the CBO partners, but what was going on for Community Catalyst. So as a part of the effort, we developed the overall evaluation plan, and I'll cover just a few aspects of it. But I wanted to share with you specifically the questions that we built our evaluation plan off of. We focused in two areas, as Cherie mentioned. We looked at specifically what were the things for the CBO partners that were working, and what were the things that were effective for Community Catalyst itself. So when we take a look at our evaluation questions, the two that are on the screen, these were specific for the CBO partners. We had two primary questions. How successful were they in accomplishing those short, intermediate, and long-term goals of the overall project, which were to increase vaccination rates among specific populations? And then also we wanted to know, did they use the resources? How were they able to access them? Were they able to use them in the way that we had intended or we would want them to? All of this information will help us better understand how were they implementing their programs locally. Community Catalyst provided overarching guidance related to the project. So the grantees had a broad range of ability to determine exactly who they were going to focus on, what types of activities, as long as they fell within those primary categories of equipping the influential messengers, creating new or expanding partnerships, and then also supporting vaccination related events and activities. Excuse me. And so in developing those questions, we are able to focus in on specifically how do we know that the program is working the way it was intended from these variety of 90 inputs to the overall outcome. Next slide, please. Then when we took a look at what specific questions that we have about what were these specific evaluation questions for Community Catalyst, we wanted to know if Community Catalyst was providing the right types of support, training, and technical assistance for their CBO partners. So understanding better whether, excuse me, understanding if the support or training they were providing were leading to more effective programs locally. Was the amount of support sufficient for the CBO partners to accomplish their program activities? And then we also wanted to know the other main question for our for Community Catalyst was, how well did they manage the project overall? Again, when you're looking at program evaluation from this national standpoint of a program that is really, you could look at it as an umbrella of many small programs overall, you want to take a look at how did that management process, because that process could basically make or break the final outcomes for the project. Next slide, please. So the evaluation team, as was mentioned, we developed both process and outcome activities that we would accomplish over the course of the project. We engaged in the project fairly early on. However, you know, we all know, or you may not know, how long it takes to set up an effective evaluation program. But we wanted to make sure that we had a lot of different ways that we could engage with the CBO partners, with community catalysts, because every evaluation, I think it was mentioned earlier in the presentations, that every evaluation should be a collaborative process. I need to reiterate a collaborative process. We could, as the evaluators, we cannot do any of this work in a silo. And his evaluation is not intended to be implemented in that way. And so we wanted to engage in every aspect from pre and post tests, how they were designed, what information we get out of them, focus groups design, implementation, what kind of feedback we were getting from activities or trainings, any of the documentation or processes that were documented. And then when we look at our outcomes, we dive deeply into the CBO monthly reports, community catalyst reports, basically gobbling up any data and information that's available in order to help provide better recommendations, to help learn more about how can we use what we've learned from these program implementation for future iterations of the project, but also to inform our vaccine efforts overall. These CBO partners are from communities across the nation, small, large communities, rural, urban communities. And so there's a lot of information to learn from them. So we wanted to take this opportunity to get as much information as we can through our evaluation process, but not overwhelming the process such that people don't want to participate. So we developed and outlined a program that would do that. Next slide, please. So for the next slide, I wanted to just talk a little bit more about one of the key aspects of our program evaluation. As you could see before, we use mixed methods using both qualitative and quantitative data to inform our evaluation process. However, one of the largest amounts of data that we're collecting from our evaluation activities is through focus groups. Typically, and focus groups are not unique to the Community Catalyst Project. They're used often in program evaluation. I think, excuse me, where our program differs a little bit is around the scale of our focus group activity and why the intent behind it. We wanted to learn more. We're capturing information through monthly CBO partner reports. And so we have the data, so we have the quantitative data, but what we wanted to learn more about were what were some of the challenges, some of the obstacles, learn more about successes that weren't easily described in the CDC reports. And so we created focus groups around understanding project implementation. We wanted to know what specific activities were the CBO partners implementing in their communities to achieve the level of success or prevented them from being able to accomplish their goals. We wanted to learn more about how they felt, the CBO partners, about the technical assistance provided, as well as we wanted to know just overall from their closing question, from our closing question was, what would you say is your the biggest success from your project? Because if there were things that these CBO partners are implementing in their local communities, we wanted to be able to describe them as much as possible so that we can then translate that into recommendations for both Community Catalyst, for the CDC program, vaccine program overall, and give it back to them as ways that they can make program improvements and such. So we conducted over a 5-week period, 14 focus groups, ranging anywhere from 2 or 3 CBO partners to 9 CBO partners on a call. A lot of work, but I think what we got from it was a lot of rich information about the programs, what they were doing, some of the challenges and obstacles they were having. I think the other part that was important was they had over 74 individuals participating, and over nearly 60% of the CBO partners participated in this activity. So we're still going through the data, but we're learning so much about how Community Catalyst in year 2 of the project will be able to support the grantees. And so with that, I will conclude my presentation. Leandra.
Thank you so much to our colleagues at Community Catalyst and to all of our speakers today for a really great discussion. Unfortunately, we don't have time for questions, but I have noted the questions that you've submitted in the chat and the Q&A feature. So I will pass those over to our presenters for them to type them up and then send it out to you all that registered today. So before we end, I would love for you all to take a really quick satisfaction poll that will help inform future events. And while you're doing the poll, I'd like to highlight some upcoming learning community events. The registration link for the May 10th event with AIM and iReach is forthcoming, and we have registration links open for a May 17th event called Partnering with Local Health Departments, and for a May 19th event, it's an Ask an Expert session about virtual event planning. So my colleague will share links for those in the chat, and for a calendar of events, you can always visit the Learning Community virtual platform at vaccineequity.urban.org. So thank you all. Again, I'll send out the questions to our presenters and get something typed up for you all and send that out. And I hope you all enjoy the rest of your day. Thank you so much for coming today.